Hello, my name is Lucia Magbayo and I will be validating for the irrigation of a nasogastric tube. First thing I will do is I'm going to check the physician's orders. After checking the physician's orders, I'm going to gather all my supplies. Okay? And then when I go to the patient's room, I am going to identify the patient, explain the procedure, and have the patient restate their name. After doing that, I am going to position in a supine position and with the head of the bed, Fowler's position to prevent aspiration, and then I'm going to place it in my working height. After doing that, I'm going to wash my hands again, and then I'm going to put on my gloves. Making sure that I provide privacy. Okay. All right. Before I start, I'm going to turn off my suction. Turn off my suction. I'm going to place my pad. Because I'm going to listen for the swish sound. I'm going to expose only the area where I'm going to listen. Okay. But before I do that, I want to check the tube is not dislodged. I'm going to check for if there's any irritation, making sure the tape is in place and the tube is not dislodged. Okay. In that case, it's not dislodged. Okay. After doing that, I am going to get my stethoscope because I'm going to listen for the swish sound to check for the placement of the NG tube. Okay. I'm going to disconnect this. Okay, I am going to take my syringe and I'm going to insert 20 cc's of air.
Okay, now, did you want me to demonstrate to you, or you guys are okay?
Okay.
Yeah, I wanted to see like
I'm going to place my stethoscope, locate the xiphoid process, and the left on the xiphoid process is where I'm going to listen for my swish sound. Okay. I'm going to insert the air. Listen for the swish sound. Okay, I heard the swish sound. After I do that, I'm going to aspirate. I'm going to put this in my litmus paper. Okay. Okay, and then I'm going to take out whatever that I have on my syringe in my drain. Take it out. Okay. After making sure I check the pH, and the pH should be less than 4 to make sure that the tube is in place. After doing that, I am going to instill 20 cc's of normal saline. Okay. I'm just going to pretend that I have. Okay. All right, I have 20 cc's of normal saline. I'm going to insert it in here. Vertical. I'm going to insert it. 20 cc's of normal saline, and then I'm going to lower it down. And then if I have the bulb, tummy bulb, it will do on its own, aspirate on its own. But if not, in this case, I have to pull back. I'm going to aspirate the content. checking to see the color, order, and the amount. Okay?
Then I'm going to go left.
After I do that,
Which is in the stomach. I'm going to put my stethoscope
I am going to reconnect.
like this. I guess you can pull up my air first. Pull up my
Okay.
air. Pull up my air. Then
I'm going to position, making sure the patient is a comfortable position.
about 8
And I'm going to lower the bed to the lowest position. And after that, I am going to turn on the pump. Once the side rails is up, the bed is on the lowest position. Give the call bell in place, put the call bell in place, and then I am going to wash my hands, take off my gloves, wash my hands, and document my INL. That's all.
my